Hello, and welcome to my presentation on magnesium, a multimodal analgesic adjunctive method to assist in perioperative pain control. This is the final report of a quality improvement project with an analysis of the data that was collected and results of the outcomes. I'm Emily Moe, a Doctor of Nursing Practice student with Metropolitan State University. In today's presentation, we will talk briefly about the original problem and purpose of this project and the intervention using magnesium. I'll give an analysis of the data collected, provide results, and evaluate the outcomes measured. There will be recommendations regarding the project and its findings, as well as a discussion of clinical practice implications. Lastly, we will quickly review how the program objectives for this doctoral degree were met. Surgical patients are a unique subset of the patient population who are at risk for acquiring an opioid use disorder. And prescription painkillers are causing a national epidemic leading to the misuse and abuse of narcotics. Opioid analgesics have continued to be the standard of care for treatment of postoperative pain for decades, despite recent and substantial evidence in the literature suggesting non-narcotic-based adjuncts can help to optimize patient outcomes. One such adjunct is magnesium, a potent non-competitive N-methyl D aspartate receptor antagonist, which has been shown to provide analgesic properties. And taking these factors into consideration, the Population Intervention Comparison Outcome, or PICO, question for this specific project was, in a rural community of surgical patients, does the use of magnesium during surgical procedures reduce the use of opioids for pain management during the recovery period compared to not using magnesium during surgery? And very quickly, the project's solution consisted of the implementation of an evidence-based practice innovation focusing on quality improvement. The specific application of the project focused on magnesium as an alternative treatment modality for pain management in surgical patients. The practice innovation recommendation was tailored toward the certified registered nurse anesthetist of a small community hospital in Wyoming, Minnesota. A research-based care guideline on the use of magnesium to decrease perioperative pain was integrated via an educational session to the CRNAs with the goal of achieving normalization of this process into their clinical practice. The overall objective of this project was to confirm that the diffusion of the practice innovation was completed through a determination of the proportion of people who implemented the guideline recommendation in relation to the proportion of people who completed the educational session. The overall objective was measured through survey data. The quantitative data was analyzed via descriptive statistics, while the qualitative data from the surveys was analyzed by grouping similar responses together, arranging them into themes. The resulting data analysis was used to determine the success of the project, with the goal of 70% of the CRNAs in attendance feeling that the education session had an impact on their individual practice, and a goal of 60% of the CRNAs actually implementing and normalizing this change into their daily care. So, as mentioned, survey data was used to provide quantitative and qualitative data, and the results of these surveys functioned as the evaluation process used to assess if the educational session was able to influence knowledge acquisition among CRNAs, and if there was an effect on their practice with an evidence-based behavioral change. The analysis looked at a change in data over time in a group of respondents immediately after the innovation recommendation, and then again in 1 month after the innovation had been implemented. The same group of 10 individuals was used, however, their surveys were kept anonymous, and as such, the data was unmatched. This data was used to assess the respondents' attitudes and general disposition toward the use of magnesium. To gather information about the respondents' feelings and potential actions, Likert scale data was used to quantify the responses. On a scale from 5, which was strongly agree, to 1, which was strongly disagree, and To further gather information on the CRNA's opinions that would not be measured with this scale data, a questionnaire was also added. The evaluation of the data represents the impact of the intervention by allowing for a comparison of the data. The comparison measures the difference in outcomes immediately after the innovation was introduced and then again 1 month following the implementation. Descriptive statistics and frequency distributions were used. A set of histograms was generated for visual representation to display and compare the outcomes of each paired question from the surveys. Significance of responses was specifically evaluated in the means of the participants' answers for each question. Diffusion of the magnesium recommendation was considered successful through a determination of the proportion of people who implemented the magnesium guideline recommendation in relation to a proportion of people who completed the educational session. A specific performance indicator of 70% of CRNA attendance was the goal. With the addition of a virtual educational component, overwhelmingly 100% of the CRNAs were able to participate in this education. As a result, the diffusion of the education was considered a success. Considering the goals of this project, it was important for the CRNAs not to just attend or be present at the educational session, but also to have knowledge acquisition of the benefits of magnesium on perioperative pain for surgical patients. In evaluating this outcome, question 1 from the pre-education survey was compared to question 1 from the post-education survey. The average response prior to the education for "I am aware of the benefits of magnesium for perioperative patients" was 3.2, or neither agree nor disagree. Following the education, the average response for the question, "After this education, I am aware of the benefits of magnesium for perioperative patients," the average response was 4.9, or strongly agree. This improvement from pre-survey to post-survey indicates that the education session provided adequate content and learning activities to promote awareness of the benefits of magnesium among the CRNAs at Fairview Lakes. An additional performance indicator was set with the goal of 60% of the CRNAs normalizing this change into their daily practice. Actualization of this objective is realized through the comparison of question 5 from the pre-education survey with question 1 from the 1 month post-implementation survey. Specifically, the average response for "I currently use magnesium in my perioperative surgical patients to help control their pain" was 2, or disagree, while the average response from the paired question of "I currently use magnesium in my perioperative surgical patients to help control their pain" from the post-implementation survey was 3.6, with 7 out of the 10 CRNAs either agreeing or strongly agreeing with this statement. Additionally, the qualitative data was grouped into themes and analyzed using summary statistics to assess the differences in responses and noticeable trends in the opinion data. Via qualitative information from the 1 month post-implementation survey, specifically question 5, 100% of the CRNAs used magnesium in their practice following the education. This data suggests a successful improvement of behavioral change in 100% of the CRNAs. Additionally, in the fill-in responses about the respondents' attitudes towards the use of magnesium in this project, 6 out of 7 were positive with only 1 neutral response. The educational session on using magnesium as an adjunctive medication to decrease perioperative pain and ultimately help decrease opioid use disorders among the Fairview Lakes Medical Center community was successfully implemented. The impact of the project was demonstrated with data supporting the acquisition of knowledge, a created awareness, and a progressive shift in attitude regarding the use of magnesium in the perioperative setting. This project has the potential to guide best practice to improve surgical pain management techniques among providers whose patients are at risk of developing opioid use disorders. Recommendations for this project include further research needed in future projects to determine sustainability of magnesium as an analgesic adjunct, with ongoing refinement of the dosage for optimal analgesia and continued measurements of outcomes. It will be important to have follow-up communication with staff on their continued efforts and experiences with magnesium, and chart audits would provide ongoing statistical results on the frequency and amount of magnesium that was used. The clinical practice implications of this project are that the incorporation of an evidence-based magnesium guideline to assist with perioperative pain management techniques results in better patient care practice and optimized outcomes for the patients of the community, subsequently resulting in increased staff and patient satisfaction and potentially a decrease in patients' pain. Limitations of this project include its small sample size with an N of 10. And the fact that this did not allow for a statistical significance testing of the data. In identifying attainment of the Doctor of Nursing Practice program objectives, here follows an explanation of how each criteria was met. First, the objective of translating scientific knowledge into nursing practice was achieved through the completion of a literature search and subsequent delivery of a current evidence-based research on magnesium as an analgesic adjunct for surgical pain. Furthermore, the literature was summarized and made into a recommendation and guideline for advanced nursing practice. Second, the objective of leading practice initiatives to influence population health care outcomes with a focus on underserved individuals, families, and communities was achieved through this author's leadership role during the implementation of a non-narcotic alternative pain medication protocol that helped serve patients in a rural surgical community. Third, the objective of utilizing information system technology to improve patient care and healthcare systems was accomplished by electronically evaluating data from this project via the individual providers, analyzing technological resources to stay proficient on the current use of magnesium, and creating an electronic order set for provider use within the project systems database. Next, the objective of facilitating interprofessional collaboration to ensure safe and effective healthcare was demonstrated during the project through collaboration with surgeons, anesthesia providers, the surgical nursing team, the pharmacy, and the systems leadership team. Lastly, the objective of advocating for public policy to prevent illness and promote population health was achieved through work done earlier in the doctoral program, with a policy recommendation made toward the Minnesota Senate regarding Minnesota public safety. In an advocacy approach, a coalition was established, data was gathered on benefits and risks, public awareness was garnered, and elected officials were encouraged to engage in support of this policy. This presentation described an innovation implementation project which used magnesium to assist with post-surgical pain. It was carried out at a community hospital among independently practicing surgical providers. The education session of this initiative ensured the CRNAs of Fairview Lakes Medical Center had the knowledge and resources needed to implement magnesium in their practice. This awareness helped to increase their confidence and ability to administer magnesium among their patients. In summary, the project was implemented smoothly, and the evaluation of the data collected resulted in overall success of the outcomes measured. As a final closing, I would just like to say that the objectives of this project were met, but more importantly, the intervention resulted in a positive impact on the CRNA's clinical practice and the patients they serve. Thanks.